Each of us must confront our fears or come face to face. We need strength, stamina, and courage to face our daily activities. But there's something that is lacking or lingering in our daily lives. We will address one of those issues today in Aware and Care, the weekly Ayurvedic program. We talk about the health, well-being, and mental well-being in this program with Dr. Ambika Nair, who's also the co-founder and chief consultant at Shantigram Group of Companies. Let's welcome her to the show. Welcome, Dr. Ambika Nair.
Namaskaram.
Namaskaram, Doctor. In today's episode, we want to talk about certain other aspects of our physiology. We've spoken about all physical health conditions. There are a lot of other psychological conditions that play an effect and role in how physically fit we are or how motivated and strong we feel. In this time of pandemic, there's constant lingering fear about so many things. Fear is there in our subconscious. It determines and sometimes overrules all our current decisions also. And when there is so much of fear built up in us, I'm sure it also affects the body. Today, let's understand what fear exactly is. So many different types of fears are there. If a parent is sick or a sibling is sick, we tend to have this fear that maybe I'm going to carry that genetic disorder with me, or the legacy of health problems which the family has carried. Professional fears, personal fears, fear of heights, fear of spiders. There's always some fear in our life. Fear that we may not be there tomorrow for our children. So today, let's understand the entire psychology and the concept behind fear. Sounds like a plan?
Yes, very good.
Yes.
Very good subject you are giving me. Okay, good. Thank you.
So, Dr. Ambika and I, let's start first with the constituency of what fear is and where does it develop from? It comes from the heart, the gut, the brain, the thinking, or it's just the circumstances of electric, shocks that goes into our mind. It's a reflex, a reaction. What is fear?
Whatever you told, everything is a contributory factor.
Oh my goodness. Okay.
Okay. So fear means that is called bhaya. Bhaya. Okay. So how it comes, because the perfect health of the human being actually, it is if the mind is good, the body is good. Always we tell like that. Complete health, especially in Ayurveda, we always tell, like your mental health. Mental health is more important in Ayurveda. Actually, because it is an ancient system of science, and even, more than 5,000 years. In Charya Samhita and everything, everything, everywhere it is written about the mental health. So at that time also this was really applicable, but so many people used to die because people are afraid to go and seek guidance. That is one of the important things, because Otto Darpoke, that fellow.
Oh, yeah.
Yeah, that is one of the things, because he will not come. Oh, Bhayamunava, okay, so he will not come. He will not come out to talk. So that is always, he will be cornered one. So,
so there is some kind of subtle bullying also that happens, or it is labeled in the community or the society where you grow up. Culturally also sometimes you feel the temperament of the personality of a particular child or one child in the houses. Okay, he's a coward or he's very fearful about everything. So the labeling starts pretty early?
Yeah, actually, because this all starts, the mental health of the child starts when they are like 5 months in the womb.
Oh.
Actually, because it comes from the genes also. And some things are contributory also. Sometimes, like maybe some diseases oriented, even like some fracture, some accidents, some things also will come like that. Okay, so
there's also a possibility then overprotection and concern of the guardians or the parents at the home, and the home also brings that fear factor, which get that nourishment ground where everybody is constantly saying, oh, he's scared or she's scared or she's fearful, leave them alone.
We had once I have gone to the Haridwar. My husband's friend, maybe he was around 55 at that time. So we all took bath in Haridwar, Ganga. So, but this fellow, he is the only child of the family. He doesn't, and he is holding a very high position.
Okay.
I don't want to say what it is. Okay. So he, took a mug and he poured water. And whereas it was really a surprise for me. Because overprotected. You use that word. That's what I'm telling. Overprotected child actually. Because don't go here, don't go, because when the child is born itself, don't go and play with such children. They are not good, because the fear is induced in the family, especially by the parents and the grandparents. Okay, so there is a they have a division. Okay, where to go, what to eat, whom to talk. So if if I'll talk to my other friends, my parents, if my parents will see, means they will scold me. So these all so many things, because actually the child should be always brought up without fear.
Enthusiastic and fearless, we expect them to be, but Dr. Nair, is cautious is one of the words that's coming to my mind as you're explaining this couple of examples here, because as part of being cautious or giving caution to the children or to any adult also for that matter, the caution itself, the way it is conveyed, instills fear.
Actually, because that caution itself will create a fear in the children. Now, because the winter here. Okay, you can be out, but don't go and play so much. Don't sit in the snow for a long time. You can fall over there. You can have an injury over there. So, they won't test that how much time they can sit, how much they can do. So that affects their confidence. So naturally, the fear is there.
Psychological drama also
psychologically pulling down the child actually.
Yeah. Friends and viewers of the program Aware and Care, of course, I use the words psychological drama. It's not only pertaining to a particular community or the kind of upbringing most of us have. It is culturally also a certain place where, the stick versus the carrot kind of a game. Okay, like Dr. Nair just gave an example. You go in the cold, you'll fall sick. If you fall sick, who's going to take you to the doctor? If we have to take you to the doctor, I'm not going to take care of you. So that automatically, subconsciously, that fear comes in, and that's where I use the word drama, just to clarify on that particular aspect of it. So Dr. Nair, we're talking today about fear and the different aspects of fear, where they start from, and we just started from the beginning where it says that, sometimes the fear is inculcated as you're growing up in a lot of communication that comes around in your surroundings.
Yes.
Okay.
Like fear of speech. Because they will, like broken words they will be using actually. They won't be able to talk properly. I like, because I get a lot of get a lot of people like that. Okay. So, with the proper care, we take them out. That I will tell later. Okay.
Dr. Nair, in this little example that you gave, I also wanted to connect up this point today here, that is it also because of fear of failure where the fear comes in? That we are not training our minds, our young adults or children, to face failures. Failure also is part of life, like success.
Failure has to be taught to the children, then only they will become successful in their life. Because there are so many incidents, in our, like everywhere, in every book, every holy book it is written, not only success, failures are also accepted.
Yeah.
Otherwise, we will not be matured enough to accept the failure in life.
In a world of 7 billion people, all 7 billion cannot be super successful. They can be moderately successful. So we have to train our minds to be there. And fear also comes with that. What happens after failure? Will I be accepted by the family, by the community, by the society? Will I have a future? So all these aspects play a very important role when fear comes in. And today we are talking about all the different angles where the fear creeps into our life and how it is going to affect our body. So doctor, you just gave us a couple of examples of how fear is coming into our mind and body, and the way we communicate, the way we give examples in life. Now let's talk about what happens when fear comes to a person. If I am gripped with fear, what is the first chemical reaction that happens in the body?
Yeah, because actually chemical reaction is there. Actually, like if pitta calms down, see, according to the constitution, how it comes, whether it is a person is pitta, kapha or vata. Okay, if he is sattvic, the whole balance will be there, very intelligent, takes good the things, But if it is rajas means, then, I want that that rat race comes in that. Okay, so that arrogance comes, grievances, and, like fearful also whether they will be succeeding.
Right.
That anxiety.
So how do you differentiate between anxiety and fear? Anxiety, are these the first
It is
symptoms of fear?
correlated, but like fear is actually very dreadful actually.
Okay.
Actually, to go from one room to other,
Mm-hmm.
if there was an accident, if somebody, because I'm narrating about my cases.
Mm-hmm.
Okay, see, one girl had an accident by the car with her car.
Mm-hmm.
She doesn't want to drive.
Okay.
Then how to bail them out.
Uh-huh.
So that was this is the way that fear psychosis. They will not feel.
Trauma-related
Yeah, it is a
events.
trauma, but I'm telling you, this is a mental trauma, so that
Mental
she
trauma.
will not feel comfortable to drive. And cases comes to me like a 50, 51-year-old,
Mhm.
very healthy, no problem.
Mhm.
Every test is negative.
Yet.
Then like a male person,
Mhm.
he's sitting in front of me. I told you, you're very handsome. Oh, thank
Mhm.
you.
Mhm.
Okay, because I know I checked his pulse. Then
Mhm.
I told can I tell you something? You don't sleep properly.
Mhm.
He told, I don't sleep at all, doctor. I told, why? I told, can I tell why you are not sleeping? He is so afraid that he will not wake up in the morning.
Wow. So
Fear
that
of
is,
death.
so
So
fear
that
is
fear
not as
is,
simple a four-letter word
yeah,
there.
it is not very simple actually. Fear of death. So this fellow's, like maybe like yawning,
Mhm.
not at all sleeping. He is very active, very good businessman. Everything is good, but only thing, his sleep.
Sleeping.
So it is a manoroga,
Mhm.
okay, psychosomatic disorder actually, because actually the pitta is very low and
Mhm.
he has gone to kapha, means his confidence has reduced like anything.
Mhm.
And like in other aspects, they will be very successful. But
Okay.
in this, because so that he get a palpitation,
Wow. Okay.
he
Mhm.
thinks that because I will die. Any
Mhm.
small things, like any pain in the body, he will think that now I'm going to, because actually it affects the heart actually.
Mhm.
Because vata related, like excess vata will be created in the body, so
Mhm.
that the vata moves in the body, and normally it comes to the, like you feel little bit of like a gas formation over there, heaviness and all. They will think that because they are going to get a heart attack. That is also one of the reasons.
So how gradually we are progressing into this topic today about fear. So if you have any questions regarding fear, please feel free to put it in the comment section. Dr. Ambika and I will be happy to address them. So Doctor, we are just gradually coming into process and a stage where we are going to talk also about that certain stages of fear are acceptable, because it is very important for a survival instinct. Certain degrees of fear is important to be cautious. That is where it is important. But there are also the aspect that you gave where it could create havoc in your regular normal life. Fear, for
Yes.
example, also, if I can give an example again about, when somebody in your family is sick, most of us are so paranoid about, maybe I'm going to catch that disease, or I'm going to get it, maybe it's genetic. Even if it is not genetic, if it could have been just situational, some problem has come up, that fear captures our life, and people are constantly getting themselves tested,
Yes,
checking Google for all
this
symptoms.
this is
And
also a fear psychosis.
this is also fear
Yeah,
psychosis.
because like some people with one symptom, they will Google in the internet.
Uh-huh.
So and they will see that okay, that they correlate with them. They have
Mm-hmm.
all the symptoms.
Okay.
Because when they come to the clinic, they will tell that I have already noted all the symptoms in me. Like
Mm-hmm.
then my friend also had some problem, so that is also in me. Neighbor had the problem, that is also in me. So
Okay.
they make themselves so fearful actually,
Uh-huh.
so dreadful it is actually, like because, and especially this COVID, this pandemic has created,
Created that,
they
yeah.
don't go out. So much they are afraid. They don't go
So
out.
not
They
only a
don't,
physical cage, they're in a mental and emotional cage where it is
so
very
much
difficult.
emotions. We
Mhm.
get, we have a case actually that is a very, paralysis patient.
Oh,
He
okay.
comes for the therapy. His
Mhm.
wife will never sit on the chair
Why?
because of the COVID.
So yeah, the fear of
She
who's going to take care
sanitized,
next.
She will tell that because she will sanitize everything wherever she comes. And I told, because the floor you are walking, no, I go out, I throw everything, then only go. Means not even sitting in the clinic on the chair. That much afraid.
So friends, we have just come to that very important aspect of fear where we spoke on a very light level as to where the fear comes from, what are the symptoms, what happens in different kinds of situations, what is acceptable form of fear, and where it is becomes very, very concerning. And now we have come to the part where it is very concerning and it hijacks your daily life, and it becomes difficult even for the dependents in your family or your friend circle to take care of those situations. So doctor, how do you diagnose this problem and where does it all start from? What are the steps involved?
Actually, when they come, because we have to be very careful with them. First of all, they are very suspicious. They don't believe anybody.
Okay.
So we have to see what is their prakriti.
Okay.
Everybody is born with a prakriti. That is their constitution. Whether you are pitta, whether you are kapha, or you are, combination of everything. Okay, then, we will talk to them. First of all, these people, we will be talking to them very nicely, taking them into confidence. Then, can I see you? Okay, then I will take their pulse. Then, we will be talking very, successfully we have to talk. Otherwise, that approach has to be very, very,
sensitive.
Very sensitive. Not only sensitive, you have to be very careful also. Because any small things means they will move away from there.
Okay.
Okay, so whatever they say, you have to listen. Then, we'll ask, because you cannot tell first anything because they don't believe anybody. Then you have to tell them, but we have to find a solution. You want to be perfect, right? Yes. Then how to go for that? Then
Doctor, I have to really interrupt you here and also understand a little more. Is it always a patient who comes, or do you see most of the time somebody is getting the patient saying that this family member?
No. Some people will come themselves, very rare. Okay. But otherwise, forcefully, the parents will bring
family support system,
and even family, somebody will bring them. Okay, then because they don't want the family people to be inside. Then I will tell them, after talking to them, after convincing is more important. Then I will talk to them that why this happened. I will take their permission. Okay. Can I talk? Then I will draw them. I will write everything and I will show them why you got all these issues. Why are you like this? Where you went wrong? So we had to correct, right? Then they will be telling, yes, we had to correct. So that is gaining the confidence. Then, we will call the, a bystander. Then only we will be telling that what diet they should take. Counseling is more important, by the way. So many times, so much time you have to give to them actually. Personal attention has to be there. Then only they will believe, otherwise they will run away. Again, I'm telling you.
So counseling plays a major part into this program. Today, we are talking about fear, as to where fears come from and how can you deal with it. Are there medications available? And is counseling the only solution? All that Dr. Ambika Nair is going to just talk as we move forward. Dr. Nair, I've come to a couple of questions here as you were explaining this. Does it happen that somebody who starts with a certain set of fears, maybe the fear of death, slowly they develop fear of certain diseases, then their fear of loss of job, loss of financial independence, does it start culminating, does it start developing one onto the other, latch onto each other?
One onto other actually, because actually if the pitta is mind is not clear, means what will happen, they start thinking very negative things actually.
So how do you when somebody comes with a chain of fears which are all latched together, so you have to source back to what is the actual fear? Was it the fear of
then we will tell that they are typical kapha vata.
Okay.
Because their digestion will not be, because how it comes, because all the toxins, mind and body, both the toxins in the mind also it will accumulated. So their aggravation of the doshas will be there.
Okay.
So kapha also. That's why at that day, these cases we do the panchakarma actually. Panchakarma is more important to detoxify the body, so that we will be able to help them, to relieve them. And they themselves will tell that now how I feel. And sometimes Virechana is, Virechana is given, Nasyam is given, Shirodhara is given. There are so many things, and their food habits, what they eat, And so many children, they are having, a fear of going to college. Whether they accept, they think that they will fail. Okay, so like because they are one thing is that overprotected. Okay, that is also one of the reasons, and their cognitive power may be little less, little backward in studies. So so many contributory factors are there, but it's very difficult also because so many children also come to me.
And also, there's so much going on in the society today, in the global world, that the constant feeding of fear is there, of whether it's a political, economic, or any kind of situation that comes in.
Yes.
Our basic survival instinct is to survive safely, and if that gets threatened, I think automatically fear also comes in. So, doctor, do you, in your experience and in your case studies that you have seen, do people genuinely come with a physical problem where the fear comes from, and it's always psychological? I'm having a pain problem. I don't know whether it's a heart attack. So what happens? Is it generally a pain which is here, or it's a phantom pain that people realize that?
No, because normally it will not be there actually.
It will not be there. Okay.
Yeah, because actually that fear of death only will come. No. I will have, like a vertigo people.
Okay,
they feel that they walk, they will fall. Like that fear has to be, and especially, like your eating habits has to be taken care. Your sleep has to be taken care. These people will not sleep. They will be, like nowadays, everybody is with either with the screen, like a screen, or in Facebook, social media, television, all those things. If you indulge in all those things and give more time, this also creates a fear.
Yeah, okay.
Because so many, that's why they tell change the channel actually.
So, doctor, what are the tests conducted for somebody who comes with this certain symptoms of fear, or when the condition gets aggravated? Are there any medical tests also done to see
their? They will blood work will be done for them for the hormonal issues and all.
Okay.
And like the chest pain, like angina pectoris, they will tell that. They will go for all the the blood work and even a heart related test, everything they will do. Then they come. That's what I'm telling. People will come and tell that all my reports are normal. So then why are you like this? I ask, then it's very, very interesting also to treat such cases.
A lot of counseling is required. Dr. Nair, I definitely want to put in this question here, that because I see some of our viewers are also asking that. How do you convince a person to start medication? Because many a times the patient will also try to convince the doctor that the problem is genuinely there. So how does the balance work?
No. Problem will be genuinely there, but the doctor's, it is the doctor's ability to find out what is the real cause. If they know how to diagnose, they know how to treat the patient.
Right.
So many people will be taking, Western medication also. So it will go like a holistic practice. You understand?
I'm coming to that exactly. So the first thing people say is calm down, listen to music, do meditation, do some exercise.
Everything they want. It is very easy to say, but when they cannot do such
go away by these activities, right?
No. Yoga will help. Yoga will help, but they don't feel like doing anything.
Okay.
Because that fear is that they become so, lazy, because they move towards, kapha. Kapha means very lazy, very anger, very, like irritating, like fighting. So the peace of mind in the house is gone.
So what I understand from this conversation is not only counseling, there's also some medication and some therapies involved.
Therapies are required for such things.
And it may take a couple of weeks for depending on the case-to-case basis.
Normally the detoxification in such cases, if it is very bad case only, we'll go for like 4 weeks, otherwise 3 weeks. Then they themselves will tell that now I am not taking that medication. I don't interfere with any Western doctor's medication. So they themselves will tell that, because now I am not taking the, their doctor will change their medication.
Doctor, I may be looking very calm right now and trying to just have a conversation with you about fear. I also have a lot of fears in life, which are some acceptable because of the conditions that we are living in. Some I have to fight with it to say that, no, this is normal, not normal, or this needs it. So at what point do I start seeking for doctor's help or a medical professional help?
Okay.
What should the family members be noticing and realize that this condition is going out of hand?
Madhavi, it's a very good question, especially this, during this pandemic. See,
Mhm.
like we will always tell, your dinner should be with family members.
Mhm.
So you can discuss a lot of things, instead of finding fault with your partner or your children or
Mhm.
your elders, you should analyze why they are talking like that, why they are behaving like that.
Oh.
If you are able to analyze and make them understand where they went wrong, then if you are able to correct means then you are very successful in life.
Mhm.
Then you can convince so many people.
So
And
at a
you,
dinner table or
even
any
at that age,
gathering, we have to see
even
for
at,
those signs of conversations
yeah,
which give.
I'm,
Okay.
I'm telling you,
Uh-huh.
because, like even when, like the children, it is, I'm talking about, like the partner or anybody, if they
Uh-huh.
are still not able to come out from that,
Mhm.
then, then they are not sleeping, they are not going to work, very lousy, not eating properly,
Mhm.
always muttering speech,
Mhm.
fearful for anything, not driving, then, then at that time really you should seek the help of a doctor.
And as a support function, also your message to all the family members or people who are living together as friends or in company, when they see such symptoms, what kind of conversations they should? Sometimes we tend to shrug off the person, like we started in this program in the beginning.
Yeah,
They are
that
bullied or they are made fun of when somebody expresses their fear.
that like that is very bad actually, because you are making somebody into depression.
Okay.
Okay, so you should motivate them.
Mhm.
This can be treated very properly. You can come out very fast. Reading your religious books are there.
Mhm.
Hearing, like Bhagavad Gita or anything like that, anything, Bible
Any
or Quran or anything,
Mhm.
anything they can read. Religious books are very good actually. Then, sitting and doing a little yoga, little meditation, and stopping the non-veg for a few days, so
Mhm.
that your bowel movements will be good, your digestion will be good. Just, because with some doctors help, I'm not telling that they should come to me, but I'm
Mhm.
telling that they should seek the help of a doctor, so that it can be corrected very fast.
Okay.
If they sit for 6 months, 1 year, 2 year, oh, he is having this problem since 5 years, then we will think that what they were doing 5 years.
So, doctor, if despite doing all this, if the fear factor is still there, I think it is best to take professional help and get that. Because as you're mentioning all this, I'm trying to analyze from my point that I think we are all missing good conversations, whether with family members or with friends. And also because we today want to blame everything on the pandemic. Pandemic maybe has exposed those little loopholes in our life and they're exploding on our face that, we were so dependent on external stimulants to get peace and hope and support, but it is all around us that we need to do. So please do suggest some foods that help us to uh, create good mental strength or emotional strength. Are there any foods or any powders
Yeah,
that
you
help?
can, almonds are very good,
Okay.
and walnuts are very good. In
Mm-hmm.
the nuts, I'm telling, all
Okay.
nuts are very good.
Okay.
And reduce your carbs. If
Mm-hmm.
you are a kapha person,
Mm-hmm.
more vegetables and fruits. Drink
Okay.
a lot of water, that also lukewarm water.
Mm-hmm.
Take a head bath every day.
Every day. Okay.
Yeah, head bath is very good actually in such cases, because it will refresh you.
Okay.
Do little abhyangam on the body, oil
Uh-huh.
massage on the body.
Uh-huh.
Oiling the head is also very good. If nothing is there, at least some coconut oil you can apply.
Uh-huh.
Okay, doing at least little bit of exercise.
Mm-hmm.
So this is, we have to understand our own body. They will
And
tell,
get.
I was not like this after some time, because as one person came and told that I was in California, I was not there, because actually this is tamas, because
Mm-hmm.
actually this is the winter over here, that this look and all, because they cannot accept, because
Mm-hmm.
they came from a very, like a sunny place.
Mm-hmm.
So that itself will become, like a little gloomy, and they are
Mm-hmm.
little afraid what will happen if something happens to me. because of the snow, whether I'll be able to drive, this all small things, very
Small
fearful.
things. You very nicely nailed it all there, because I think these fears are there in all of us subconsciously.
Yes.
Some of us try to pretend that it's not there, but we are also concerned that once this pandemic is over, when life gets back to supposedly routine, how many of us will be able to communicate again? Friends, when
Yes.
you're watching this program, you must be wondering that this program seems to be going from a different angle to a different angle. What exactly is a diagnosis? What exactly is a medication? Well, Ayurveda talks about mind, body, and soul. It's a combination factor. And today we were talking about fear. And the entire conversation, what has come out the most is that talking, counseling, conversations are very important, and which plays a very important role for the treatment also. Dr. Nair, please do add on anything else that we have missed for anybody out there who are going through these concerns of fear, unwanted fears, or genuine
Unwanted fear.
fears.
This is a good word actually. It is a very good diagnosis. Unwanted fear.
Mhm.
Whether I will be able to go to, because their own native country.
Mhm.
We here so many immigrants are here, so
Yes,
people are
yeah.
afraid whether I'll be able to see my parents, because I'm telling about the concerns of the patients who comes to me.
Uh-huh.
We won't be able to travel.
Um,
Some people are stuck. So many issues are there, like not only one, pandemic is also one of the factors. That's all.
This has been a
And
very, very eye-opening episode, Dr. Nair. On one side, there is reality, and the other side, there is fear. When we
Brahmi
try
is
to when we try to
Brahm,
balance the both, we will actually know where we are standing. Reality
yes.
you need to accept, and fear is something you need to fight, and maybe sometimes take medication
Yeah,
and
you should
medical
always think
treatment.
that you will be, like think positive, then you will be able to come out.
Mhm.
You will tell that because it's very easy to say think positive, think positive. If you cannot think positive, come to the doctor, they will help you. They will take care of you. Come with
Absolutely.
confidence.
Absolutely. That sounds so assuring and so comfortable to know that Dr. Ambika Nair, her entire team is available for direct counseling here in the tri-state, and also right now she's available for all the global patients who are reaching out to her through virtual mediums, through Zoom also. So you can reach out to Dr. Ambika Nair and her team, and all the numbers and details have been given on the screen. Thank you so much, Dr. Nair. Any final words from you to the
Yeah,
families and people who are
Ashwagandha is
watching?
very good actually.
Ashwagandha, okay?
Ashwagandha is very good, like Brahmi is very good.
Mm-hmm.
This all very good actually.
But
And
those, they have to consult a doctor before taking the proportions.
no, everybody, because those who come to me, they will tell that I was taking Brahmi, I was taking Ashwagandha, then I will tell that very nice. So you know about Ayurveda, so I feel happy.
Okay.
Okay. So how much they take? Then so many people telephone and ask me, they message also how much I should take.
Okay.
It all depends upon the age, weight, and a body. Yeah.
A little bit of consultation will take you a long way, and maybe you can help many other people and save many lives
Yes.
in the process. These are only the sprouting problems of fear that we have touched base in this program. And fear by itself is a huge family, and it has a huge ocean of
Fear of height.
bylines attached to it. So in the coming episodes, we will talk about many other issues that relate to your emotional well-being and mental well-being. We want to thank Dr. Ambika Nair and an entire team for this episode. Thank you so much, Dr. Nair.
Yeah. Try to sleep in time. That is my real request for everybody.
Okay.
Okay. If you sleep in a year, 80% of the problems will be solved.
Sure. So on
Don't
that
sit
note,
on internet.
yes, on that note, we would thank Dr. Nair again for this episode on fear and getting remedies through Ayurveda, the natural way, and having a good mental and emotional well-being. Thank you so much, Dr. Nair. We look forward to the next episode with you here on Aware and Care.
Thank you so much.